I read this 1997 report from the Expert Committee on the Diagnosis and Classification of Diabetes mellitus under sponsorship by the American Diabetes Association. On the surface is a detailed medical report, but his real contribution was establishing a clear framework for how diabetes is diagnosed and classified. The report begins by shifting diabetes classification from treatment-based to cause-based, a step that helped bring more clarity to the many forms of the disease. This table shows the etiologic classification of diabetes mellitus, identifying many distinct causes. Specifically, it defines type 1 diabetes as resulting from beta cell destruction, usually leading to an absolute insulin deficiency. The committee divided type 1 diabetes into two forms: immune-mediated, where the immune system attacks the beta cells from the pancreas, and an idiopathic form, where the cause is unknown but insulin deficiency still develops. The committee also revised the diagnostic criteria to better match where diabetes complications begin. This table shows the revised criteria for diagnosing diabetes. A diagnosis can be made with symptoms and a glucose level over 200 milligrams per deciliter, a fasting level of 126 milligrams per deciliter or higher, or a 2-hour glucose value above 200 milligrams per deciliter after an oral glucose tolerance test. This report didn't introduce new data or discoveries, but it did help bring the field together, giving researchers a shared structure and language to build on. For that, I rated a 6.5 out of 10 on my completely made up type 1 diabetes research score. There's a link to the full report in the description, and a special thanks to the authors for keeping it open access. If you're interested in type 1 diabetes research, subscribe for more.